here. So glad you're there. Talking today about hormones. Everybody's got them, and everything goes wrong with them, and people get a little wacky, and they don't know what to do about it. And, a lot of times we talk about hormones, we think about women and estrogen and menopause and perimenopause. And, that's one, but hormones control everything. Boys, us too. It controls everything. So you can have, we talked about hormone imbalances, chronic stress, type 1 and type 2 diabetes, hypoglycemia, overactive thyroid, poor diet nutrition can cause hormonal imbalances. Nodules on the thyroid can cause hormonal imbalances. Tumors, endocrine gland injuries. If you get punched in the kidneys, let's say, the adrenal glands are right there. That can be an issue. Severe allergic reactions and infections, cancer, hereditary problems, anorexia. All these things can throw off your hormones. So that's a big issue. That can cause problems. And we all do these things. We're all doing bad things all the time, and we got to stop doing them. Because if you just keep abusing your body, it's going to be a big issue. So let's start taking some callers. 844-44 Joe. Let's see if we can go to Rhonda. Rhonda, how can we help you today?
Hey, Dr. Joe. Thanks for taking my call.
You are welcome.
Quick question.
Sure.
How do you determine if a woman has started in menopause or perimenopause or in the middle of it, and is there any hormones over the counter that you could supplement if you are?
Sure, absolutely. Well, you're in menopause if it's been 12 consecutive months without a menstrual cycle. So that's how we know you're in menopause. Now, perimenopause, of course, builds up to that. So you might be skipping a cycle here and there, or 2 cycles, 3 cycles, and then it starts again. That would be perimenopause. Now, we can do a hormone test at our office. We do 2 things we can do. One is a saliva test, and one we can actually do blood work. And we can do a hormone test for you. So what happens is, as we go through the cycling, there are certain things I would recommend. Now, if a woman isn't in menopause, if you're normal, menstrual cycle age, we have something called Estrogen Regulator. And that's on the website, drjoe.com. And what it is diindole methane. And now if a woman's in menopause, it's a little trickier than that, but we do have something called women's hormone support. And that's DHEA. That's what we were just talking about. The adrenal glands produce pregnenolone, which becomes DHEA, which then becomes your sex hormones. So we have the men's DHEA and the women's DHEA. I take the men's DHEA every day because it's DHEA, which then becomes my hormones. So if it's 12 consecutive months without a cycle, you're officially considered in menopause. If you're skipping a few here and there and then they come back again, it's perimenopause. We can do a test for it, of course, but I would recommend the women's hormone support for everybody because it gives you the raw materials to produce your hormones. Okay?
What about soy products?
Soy has something called phytoestrogens. Now, phyto means plant, and they're weak estrogens. So estrogen is a hormone, and what it does, it goes into a cell, and it kind of docks, if you would, into the cell, like a ship would dock into another ship, and that causes the cell to do things. It tells the cell to do certain things. So soy and a lot of plants, all beans, most beans, I think, have phytoestrogens in them. So they block up the receptor site, so it kind of activates the cell a little bit, but not a lot. So soy, I'm okay with soy. I am not one of these anti-soy people. It has to be organic, and I would prefer that it's fermented like tempeh. But if you eat a little bit of soy here and there, other beans have phytoestrogens too. It's just that soybeans have a lot more. So if you're eating organic soy periodically, once or twice a week, I have no problem with that at all.
Okay. Well,
Okay?
thank you so much. You have a good day.
Thanks so much, Rhonda. And folks, if you have questions like Rhonda did, give us a call. Number here at the studio, 844-44-DR-JOE, 844-44-DRJOE. Okay, so we're talking about hormones today. And women, of course, we have puberty, menstruation, pregnancy, childbirth, breastfeeding, perimenopause, as Rhonda was talking about, menopause, and then postmenopause. So the hormones are going to fluctuate as time goes on, and the estrogen is a big one. And for women especially, and that a lot of problems can occur when a woman starts getting low in estrogen. So medical conditions that can cause irregular hormone imbalances, polycystic ovarian syndrome, PCOS. I see a lot of this. We'll take x-rays of a patient at our chiropractic offices, and we'll see some tumors in the ovaries. And it's like, okay, so that's an issue now. Let's see what else is going on. Hormone replacement therapy, birth control pills. It's a hormone. How birth control pills work is this. The body thinks that it's pregnant. So it tricks the body into thinking that it's pregnant so that it doesn't menstruate, so it doesn't ovulate. So that's how it works as a birth control. But in theory, you should only be pregnant for what? 9 months. So if you're pregnant for years and years, that becomes an issue. Early menopause can be an issue. Primary ovarian insufficiency, ovarian cancer. These are things that can throw off a woman's hormones and, of course, anything that has to do with the adrenal glands. But symptoms for women: irregular periods, painful periods, indigestion, vaginal dryness. That's very prominent in older women. Indigestion, constipation, diarrhea, infertility, weight gain, thinning hair, saggy skin, abnormal growths, a deepening of the voice. These are all signs that a woman can have some hormone imbalances. Men, we're not as complicated. We're a little easier to work with. Puberty, things that can affect men's hormones. Puberty, aging, prostate cancer, the testicles not working properly, and then adrenal gland issues, because, again, the adrenal glands produce a lot of your sex hormones as well. Symptoms for men: reduced sex drive, erectile dysfunction, low sperm count. This is important. I'm going to talk about that low sperm count in a little bit. Reduced muscle mass, reduced body hair, overdevelopment of breast tissue called gynecomastia, breast tenderness, osteoporosis. Now, my father was diagnosed with something that they thought might have been, I keep a lot of adjectives in there, maybe the early stages of prostate cancer. Now, as men get older, it's been said, and I don't necessarily agree with this, that all men are going to get prostate cancer, but they're going to outlive it. I don't think that's true. I think that healthy men aren't going to get prostate cancer. But they found something, and they said, we can give you a hormone to shut down your testosterone production. So, much to my chagrin and my argument, my mother and father decided to give my father this injection, and it was amazing. My father had great musculature on him. He had a beer belly. He had a gut on him, but he had great muscles. My father was in amazing shape when he was young because he worked. He didn't work out. He just worked. And I noticed that after he had the shot, the hair fell off his chest. His muscles got weak and saggy. His beard wasn't growing in very well. And then he died. Now, one of the things that you don't give this injection to is somebody who had a heart condition. And it clearly said in the medication, in the warnings, do not give to somebody with a heart condition. My father had a heart condition. And I submit that that killed my father. So you don't want to mess around with hormones. But I noticed a change in his body, everything. And he just got weaker. He got more feminized. And I saw an amazing change in a very short period of time as the testosterone levels dropped. And then you need testosterone because testosterone makes your muscles contract. And not just your biceps and your triceps. How about your heart? So you don't want to take away the production of testosterone to somebody who has a weak heart because it can stop. And that's exactly what happened with my dad. So I'm not a big fan of hormone replacement therapy unless you have to have it. And in my father's case, I still submit that he didn't have to have it. It was a precautionary measure that they took to keep him from getting prostate cancer, and it worked. He didn't get prostate cancer. He died. So I'm not a big fan of thyroid, of hormone replacement therapy unless you absolutely positively have to have it. Now, if there's suspected prostate cancer, there's a lot of things you can do. We did a show a while ago on men's health. If you go to our website, drjoe.com, we covered a lot of things in men's health that you could listen to the whole show there. Plus, got to go to break. When we come back, we're going to talk about some treatments that you can do to help balance out your hormones for men and women, because I know that's what you're waiting for. If you have any questions, lines are open, 844-44-DR-JOE. My website, drjoe.com. Over 1,000 hours of podcasts on the website, audio and video. If you have any questions, send them to me through the website. I'm more than happy to answer your questions. We have a blog there. If you send us your email address, we'll put you on our newsletter list. We had a great live event last week. It was folks on the newsletter list that got it. Folks, I'm Dr. Joe Esposito. We'll be right back.
0.5 WSB, Atlanta's News and Talk.
Hey, Dr. Joe here. So glad you're with us. Talking about hormones today. And it's important because so many people have hormone imbalances and don't know what it is. They might be moody. They might be grumpy. They might have trouble sleeping. There might be a romantic issue involved. And no one ever knows where to point. And so at our office, we can actually do a micronutrient test. And we can add on to that test a hormone test. And so we can test men and women's hormones to see if there's an imbalance there. And if there is, then we can give you some suggestions. Not necessarily hormone replacement. That's not what I do. The medical doctors do hormone replacement. We actually give you the nutrients to get your... Wow, phones are lighting up like crazy. We give you the nutrients to help your body make their own hormones. And I like that approach better because if I give you hormone replacement therapy, what happens is your body says, okay, I got plenty of testosterone. I don't have to make any more. Now, sometimes you need hormone replacement therapy. I'm not saying you don't, but I like to try a conservative approach first. And then if we need to, we can refer you out to an endocrinologist. We refer you out to a orthopedist, neurologist. Again, we're a team of chiropractors. And so we see a lot of pain patients, of course. And I'm even board certified in pain management. I think I'm the only chiropractor in the state board certified in pain management. I'm also board certified in orthopedics and double board certified in nutrition. So we get a lot of pain patients, a lot of patients that other doctors can't figure out what to do with, referrals from dentists. And so when we work with the patients, we try to get them well and get to the cause of the problem, not just treat the symptoms. And that's how we approach hormones as well. We try to get the body balanced. So let me see. Emma, hold on one second. I want to finish this little segment here. I'll get right to your question there. It's my grandmother's name, Emma, so she's not with us anymore. All right, couple of things. Options that are available to treat the symptoms for women's hormone imbalances, not the cause, the symptoms. Birth control pills. Of course, birth control pills are a big one. Of course, birth control is a big issue. I think everyone needs to be aware of that. It can be given for irregular menstrual cycles and symptoms. People can take birth control medications, of course, for birth control. And there's multiple options. You've got the pill, the ring, the patch, a shot, an IUD. People ask me all the time, Dr. Joe, what would you consider the best form of birth control? And the barrier method is probably going to be the best form. But the IUD is something that's probably going to be, probably most people are going to be more better with it. Now, if there's two types of IUDs. An IUD is inserted into uterus, and it prevents the fertilized egg from implanting into the wall of the uterus. And so that's how the birth control works with the IUD. It's called intrauterine device. And some have hormones in the IUD, some don't. Talk to your doctor, of course. This is not my specialty, but I would suggest that you look at the non-hormone IUD, along with, as a good Catholic boy, I have to say this, the rhythm method. Because what happens is a woman ovulates, and when she ovulates, she's only fertile really for a few hours a month. So you got to make sure that you can figure out your ovulation cycle. And what you can do is figure out when your menstrual cycle is going to start, count 14 days back, and chances are that's the day you're ovulating. Now, science has come a long way. And so now we can actually monitor your temperature when you're ovulating. And I would suggest then abstinence or certainly avoiding contact during the fertile days. I take 2 days before and 2 days after of the fertile time when you're ovulating. And just be really careful around that with an IUD, but make sure you get your partners tested because you got a lot of cooties out there running around. So make sure you get your blood work done and make sure everybody's cool if you're using a non-barrier method like that. So it's important to understand that because you can get really sick and die from communicable diseases like that. So just be careful. You're going to play in the big leagues, folks. Got to follow the rules. That's pretty much how it's done. So that's my opinion on birth control. People ask me all the time. Now it's memorialized. Vaginal estrogen is a big issue. As women get older, many times they have vaginal dryness. Now, there are creams you can apply directly into the walls, estrogen creams or rings that can reduce vaginal dryness, but you can also use things like coconut oil because they don't have chemicals in them, and it's not going to cause a chemical imbalance like the estrogen can. So coconut oil, extra virgin organic coconut oil is very, very good for that, and it solves a problem there, and you have to worry about the hormone imbalances. Hormone replacement medications, they can temporarily relieve symptoms associated with menopause, such as hot flashes or night sweats. But we're going to get to some natural treatments you might want to consider for menopause and night sweats as well, some certain herbs that have been shown to work very well for that. Anti-androgen medication. Androgen are male sex hormones, and if women start having too much androgen, too much testosterone, they start growing hair, getting a deeper voice, you can give them medicines to deal with that. But again, you're messing with Mother Nature. And then, of course, assisted reproductive technology, in vitro fertilization, has become very popular. And the reason is this. I did a show on men's health a while ago, and it turns out that statistically, about 50% of the men in North America and Europe can be considered sterile. 50%. And the reason is the sperm count among North Americans and Europeans is plummeting. It's dropping, gosh, what was my stats? 20% every 5 years or something like that. And if these stats continue, you got to look it up on my website, drjoe.com. But if these continue, and it looks like they're going to, we're going to have a very sterile environment when it comes to reproduction for men. And so in vitro fertilization is becoming more and more popular because a lot of men just aren't able to reproduce anymore. And I believe, my opinion, is that men are being exposed to so many chemicals, so many estrogen-like compounds. Things like hairspray, anything that smells, anything that has a unnatural odor to it. Room fresheners, carpet cleaners, hairsprays, deodorants, anything that has a fragrance to it, and that's what you look for, the word fragrance or parfum, these are endocrine disrupting hormones. So I'd strongly advise you stay away from it. That's why in my house, I don't even have carpets. Everything is hardwood and tile because carpets can lead to a lot of buildup of viruses, germs, bacteria, fungus, mold. And if you use chemicals on it to clean it, that's not a good thing. So let's start taking some callers. 844-44 Dr. Joe. Emma, how can we make your day better?
Hey, I had a question back to what you were talking about with the DHEA.
Yes.
I was wondering what age you recommend women and men start taking that, and what are the symptoms and benefits of taking it?
Okay, so DHEA is the precursor, the building block to your sex hormones. So again, pregnenolone in your body becomes DHEA, and then DHEA either becomes your sex hormones if you're functioning normally. If you're under stress, it becomes cortisol. So usually around 35 is a good time if you're under a lot of stress. 40 is certainly a time I think everybody should be taking it. If you're under stress, maybe 35. And it's one little tiny pill. It's no big deal. For women, it's a lot lower dosage than for men. But if you're under a lot of stress, you instead of producing DHEA, you're probably producing a lot of cortisol. The DHEA then will be able to have you produce more of the DHEA. So 35 or 40 is a good time to start for men and women.
All right.
Okay? Anything else?
All right, thank you.
All right.
Is it something you can get over the counter,
Sure.
or is that something that you would be prescribed with?
Yeah, go to our website, drjoe.com, and it's right there. We have women's hormone support and men's hormone support. So both are there for you. Being a woman, you get the woman's one. And if you pick it up in our offices, we have offices in Marietta, Duluth, and Stockbridge. Hey, folks, Dr. Joe here. So glad you're with us today. Talking today about hormones, apparently a very hot topic because the phones are lighting up, social media is lighting up. Oh, by the way, follow us on Facebook and Instagram, too, because we live stream a lot of our shows, and we put a lot out there on social media as well. So make sure you follow us on Facebook and Instagram. If you like us, give us a nice little promotion out there. We'd like that. Garrett looked it up. I talked about sperm count. Sperm count has dropped 50% in the past 40 years. Now, that's important. So, if your grandfather had 50% more sperm than you do, this is now becoming a big issue because it's continuing to happen. So right now, you can still make babies, but as time goes on, your sperm count, we as a society, sperm count is dropping dramatically. And it needs to be brought up. I'm the only person I know of that's talking about it in the media right now. So guys, take care of yourself. Stay away from endocrine disrupting hormones, plastics, vinyls, hairsprays, any type of artificial scents, perfumes, scented deodorant, shampoos. Just use the stuff that's more natural, please, because it's affecting every aspect of your body. And if it increases your estrogen levels, estrogen is a growth hormone. And it makes the body grow, and we don't want the body to grow anymore. If you're done growing up, that means you're going to start to grow out, or worse yet, abnormal cell growth. Let's see. Who was first? Oh, here we go. That's it. Russ, thanks for holding. How can we make your day better?
Hey, Dr. Joe. I know I've heard you talk about iodine being good for the thyroid.
Yes.
But are there foods that I can eat to improve my thyroid function and maybe get me off my medicine and get it working normally?
Sure. Well, I can't guarantee anything, but the minimum supplements you should be taking every day are Dr. Joe's Supergreens and Dr. Joe's Essential Source. You've heard me talk about that forever. We put sea vegetables, iodine-containing sea vegetables, in both the Supergreens and the Essential Source. Because one thing we are deficient in this country is iodine. It's iodine, magnesium, omega-3 fatty acids, and vitamin D. So, yes, that's why we put Supergreens in Essential. That's why we have it in the Supergreens and the Essential Source. It's a great source of iodine. Sea vegetables are the great source of iodine, and most of us don't in the United States eat a lot of sea vegetables. So that's why that's why I try to put it into Supergreens, the Essential Source. You also want to avoid chlorine, fluorine, and bromine. Chlorine, fluorine, and bromine are what we call haloids. They look like iodine. And so when they get into the body, they can block up your iodine receptor sites in your thyroid, and you can't absorb iodine. So you got to get iodine in the diet, and you got to be able to absorb it once it's there. So chlorinated water, fluorinated toothpaste, not a big fan of any of those. And even bromine is used as a dough conditioner. A lot of commercial breads, fast food restaurants, they'll use bromine in their dough, and I don't like that either. So avoid the chlorine, fluorine, and bromine. Take Supergreens and Essential Source. You should be good.
All right. Thanks, Dr.
Thanks,
Joe.
Russ. I appreciate it. And, folks, if you do have a question, 844-44 Dr. Joe. Somebody called in, wanted to know when we're going to open up in West Cobb. Soon. We're working on it right now, as a matter of fact. It looks like it's going to happen. I would give us probably a couple of months maybe, but hopefully we'll be open soon there. So if you're wondering. And we're also kind of sneaking around at Decatur, too. We're kind of sniffing around in Decatur right now as well. So we may open there as well. All right, Veronica, how can we make your day better?
Hi. I had a question about the DHEA. I was
Yes.
thinking about taking it after I had been to a gynecologist and was having problems with cysts and fibroids, which she, of course, said birth control, but I told her I was against birth control, and then she shut down and wouldn't help me.
Sure.
So I was doing some research, and I thought DHEA might help me, but at the same time, I've had experience with hair loss in my past,
Yes.
and I've seen in the research that it can cause hair loss.
Yes.
Is it better to take it than not in my situation? I guess depending on the cyst and fibroids, that sort of thing.
Well, taking the DHEA is going to help build the normal hormones. Usually it's a hormone imbalance that causes the hair loss. It could be a thyroid issue.
Right.
And the thyroid, the pituitary, and the adrenals all feed off each other. And so the problem is there's
Okay.
no test to see if they're all working in unison. There's nothing we can test. We can test the adrenals, we can test the thyroid, test the pituitary, but we can't test them to see if they're working together. And that's why it's important to get that iodine in your diet. And that's what the last caller was about. So Dr. Joe's Supergreens and Dr. Joe's Essential Source, that's the great source of it. Now, taking too much DHEA can lead to hair loss. Absolutely. But
Okay, so that might be what's causing it for some people.
yeah, if you're taking too much, but I don't know anybody's even taking it. That's the thing. So for the women's dose, it's 5 milligrams we have, and I've never had anyone ever have a problem with that. So, and then
Okay.
I'd also recommend Dr. Joe's Adrenal Support because the adrenal glands are where it's coming from, right? So, yeah. So,
What's the difference, if I may ask? What's the difference in your adrenal support and the other adrenal support supplements that I see on the market?
mine has my picture on it.
I got it. Okay.
Have you ever saw that?
I had that coming.
You
All
ever
right, thank you.
Yeah, you ever see the movie Spinal Tap? I don't know if you ever saw that movie. And he's talking about the speakers. He goes, well, ours goes up. Most speakers only go to 10. Ours goes to 11. He says, yeah, but if that's the maximum, what's the difference? Well, ours goes to 11. Yeah, but it's still the same. You know, I know.
I appreciate your honesty.
No, I know the quality of ours, and there's a lot of. I was going to say crap. Can I say that on radio? Okay, Ahmad says yes. He's my engineer. He says yes. There's a lot of junk supplements on the market, and that's why a lot of times I'll see studies on supplements. They'll say, we did a study on this supplement. It doesn't work. Well, that's because they use a synthetic version. They use a cheap version. And so you want to make sure you have a non-synthetic supplement across the board. All of ours are non-synthetic. So I know the quality of ours. I don't know the quality of everybody else's. I'm sure there are other good ones out there, but I don't know that because I only know mine. So.
Right. Okay. Well, thank you.
Thanks, Veronica. Appreciate it. If you do want to order supplements, folks, it's on the website, drjoe.com. Garrett has to say he's getting excited.
So that was that's actually a good point. The idea of hair loss from taking DHEA. It's from the unsupported idea or theory that ingesting DHEA would increase dihydrotestosterone.
Dihydroxytestosterone.
Yeah, that one.
Okay.
But there's no evidence.
Okay. Yeah. So yeah, and the dihydroxytestosterone is the hormone that makes the hair fall out. But there's no evidence of that. So yeah, so we're good there. And again, it's a small dose we give you, just enough to kind of jumpstart the adrenals, and then we also get the adrenal support as well to get the adrenals working properly. So. We're going to do a head-to-toe with Dr. Joe and do liver. We're going to talk about the liver today. Did we do gallbladder last week? What did we do last week? I don't even remember what we did last week.
What did we do last week?
I don't know.
Oh, we did the spleen.
Spleen, that's right, yes.
Spleen.
Yeah, I think we did gallbladder a while ago. So we're going to do liver today. We're going to talk about the liver, how it works, how it doesn't work. I'm sure there's going to be some wise guys out there. I don't know if you ever listen. I'm a guest on Eric Von Hessler's show every other week. And Anti-Dr. Joe is on Eric Von Hessler's show. So Anti-Dr. Joe is my nemesis, and he comes on and he tells people bad advice. So I'm not going to give you any Anti-Dr. Joe advice. I'm only going to give you true, honest-to-goodness Dr. Joe advice. But that Anti-Dr. Joe, he's evil, that guy.
I feel like I know what he would say.
You think so? I wonder what Anti-Dr. Joe would say.
Point 5 WSB by Virtual Imaging.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Here to help us, Dr. Joe Esposito, who is a pain management specialist.
Dr. Oz himself has been nice enough to call in.
Joe came on. He was a wonderful guest.
Dr. Joe Esposito.
I got rid of Google after meeting Joe. You know, he's got encyclopedic knowledge.
There's so much research out there. And so many of you don't know that there's something you can do to get yourself well. So why would you take the risk of putting something in your body that might cause some real serious neurological damage? And that's where the problems come in. And that's why we do this show. The best health and wellness show in the world. Stop suffering needlessly. Every day, patients come in our office and say, Dr. Joe, why didn't I do this sooner? And my answer is, I don't know. Hey folks, Dr. Joe here. So glad to have you with us today. What we're talking about today is hormones. But before we talk about hormones, we got to do this.
Talking head to toe with Dr. Joe.
Yes, that means it's head to toe time with Dr. Joe. And what we do in this segment is we talk about different parts of the body and how they work. And today we're going to talk about the liver. Now, the liver is really important. It filters out toxins. Food is broken down. Everything you eat goes through your liver. Everything you drink goes through your liver. And the problem is you beat the heck out of your liver. And we're just abusing our liver all day, every day. And then we expect it to work properly. So some of the problems that happens is if you eat a high sugar diet, high fatty diet, bad foods, what can happen is the liver can start to get fatty and the liver can malfunction. So there's a lot of advice I would give you as to what to do when it comes to liver problems. And, it's funny because I do a show with Eric von Hessler, and we have Anti-Dr. Joe on that show, and he gives you Anti-Dr. Joe advice. I'm just so glad that Anti-Dr. Joe isn't with us today.
No, in fact, one of the things that happens to me every day is my patients come into my office and they say, Dr. Evil Dr. Joe, they say, well, what is the key to having a good, healthy, strong liver? And I said, every single morning you take the powdered donuts out of your cupboard and you batter them and you deep fry them. And then you wash them down with a big, tall glass of grain alcohol. You do that every day. And then at night you have a giant steak and make sure it's cooked till it's well done and you coat it with butter.
Anti-Dr. Joe, where did you come from? Did you sneak in?
Well, you got to have a balancing viewpoint. And what I tell everybody when they come into my office, because these people, they're just hanging outside. They're walking down the street. They walk into my office, and they ask me, how do I take care of my liver? And the first thing I do when they ask me that question is I give them a menu for the week. A lot of beer, a lot of alcohol, all sorts of cigarettes, all the wonderful things that keep your body sharp.
So, Anti-Dr. Joe, you don't necessarily agree with the advice I give then.
Well, I believe that everybody needs a second opinion, and that's why people come to Evil Dr. Joe after they go to the regular Dr. Joe.
Well, Anti-Dr. Joe, I'm so glad you were able to give an opposing view today. Can you come back next week, maybe give us another opposing view?
Yes, I'd like to tell you how I correct a spinal problem using 2 tennis balls wrapped up in a sock. I will talk to you next week.
Thank you, Anti-Dr. Joe.
I'm getting an appointment with that guy.
He's good. He's smart, that Anti-Dr. Joe, isn't he? Oh, God. Well, we're on the Von Hessler show, and that's Tim Andrews, the Anti-Dr. Joe, and he's absolutely one of the most amazingly talented people I've ever met, and he's so funny. And so Anti-Dr. Joe, he was kind enough to come on and give us the opposing viewpoint, which is wrong, by the way, Anti-Dr. Joe. So you got to take care of your liver. Don't follow that advice. In fact, you want to eat foods that are easy to digest. You want to make sure you're not putting a stress on the liver. And the big things that put stress on the liver, of course, the first thing you think of is what? Alcohol. Alcohol puts a big stress on the liver, but so does sugar. How many people eat sugar all day, every day? Breads, cookies, cakes, donuts, pastas, powdered donuts, deep fried, like Anti-Dr. Joe suggested. The sugar in the body, glucose is utilized as fuel by the body. Any other sugar you put in there, maltose, fructose, galactose, it has to be converted into glucose. And in the process, there's waste products that are produced. Like for fructose, for example, uric acid is produced. And uric acid can get in your joints and it hurts. Now, as a team of chiropractors, we want to get you on an anti-pain diet, not a pro-pain diet. Propane diet, look at that. There's an interesting word there. But so many people are doing things to fight us. They'll come in as patients and we'll give them what I consider some of the best chiropractic care in the world. My doctors are off the chart amazing. Dr. Irwin, Dr. Amy, Dr. Sam, Dr. Kat, Dr. Ryan, they're all just amazing doctors. And then you go out and ruin it, well, don't ruin it, but fight us with eating a bad diet. So you want to take the stress off the liver. And the liver does a lot of things, including produce enzymes. So one of the secrets I want you to do to take care of your liver is eat something raw at every meal. Now, when I say raw, broccoli, cucumbers, tomatoes, avocados, salad, raw food has enzymes in it. And if you eat something raw, 80% of the digestion occurs from the enzymes that are in that food, in the carrot, in the broccoli, whatever it is. So things like Dr. Joe's Supergreens, Dr. Joe's Essential Source, loaded with enzymes. One of the many gazillion reasons I recommend the minimum supplements you should be taking every day are Dr. Joe's Supergreens and Dr. Joe's Essential Source. Iodine for your thyroid and active enzymes. to help the body break down food and take the stress off the liver. Drinking a lot of water is really important to take care of the liver. And if the liver is toxic, if the liver isn't working properly, and again, we can do a micronutrient test at our office. We can get a blood work done on you, and we can also test your hormones as part of that test as well. It's a separate add-on. You have to make sure you ask for that additional thing with the hormones. We can test enzyme levels. We can test enzymes by looking at your food. But whenever I eat something cooked, if I have a soup, let's say, or if I'm going to have something that doesn't have something raw in it, I take Dr. Joe's digestive enzymes. And let me tell you, it's a whole new world when you start taking digestive enzymes to help digest your food. And as you get older, more important than ever to make sure you're getting your digestive enzymes in there. So Dr. Joe's digestive enzymes for cooked foods, Supergreens, an essential source, minimum supplements you should take every day. And then if we do find something wrong with the liver, I might recommend something called milk thistle. Now, it's not a Dr. Joe product. We carry it at our office as well. But milk thistle has been shown to help liver function as well. The problem I have with milk thistle is if I take it and I take even a recommended dosage, I get a headache from it. My liver detoxifies so quickly that I actually get a headache. So I tell people, start here, see how you do, and then we may have to actually reduce your dosage of the milk thistle. But as soon as you cut out the 7 deadly sins, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, and under sugar, breads, cookies, cakes, donuts, and pastas, now the liver is able to start to heal. The liver is the fastest healing organ in the body. So the good news is if you've just abused your liver with the 7 deadly sins and alcohols and sugars and everything else, you've put in medications, if you take acetaminophen, I recommend taking something called glutathione. Most patients that take medications, I'll recommend glutathione because glutathione is the antioxidant in the liver that helps the liver function very efficiently as well. So folks, if you have any questions, the lines are open right now, 844-44-Dr. Joe.
As a retired dietitian, can you say overachiever? Dr. Joe Esposito on 95.5 WSB, Atlanta's News and Talk.
Hey, folks, Dr. Joe here. Boy, hot topic today. Oh, my microphone's sliding away from me there. Hot topic today on hormones. Everybody seems excited. Social media's lighting up. The phones are lighting up here. If you have a question, not just about hormones, but anything in health, 844-44-Dr. Joe, pain management, numbness, tingling, car accidents. Hey, if you've ever been in a car accident, if the car was damaged, you were damaged. You need to come see us. We get patients all day, every day, just because I say this on the radio. If the car was damaged, you were damaged. I say, I didn't even think about that. But you know what? A couple of days later, I started having some symptoms. It didn't happen right away. But the quicker you get to us, the better it's going to be. Because the insurance companies, they will use every trick in the book they can to not pay your claim. And one of the tricks they use is, well, you waited too long to go to the doctor. I don't know what that's based on, because symptoms can take up to 6 months to show up after a trauma. But it's just one of those things. It's my friend Renee walking by the studio. So, get to us. Stop suffering. If you have a health issue, it's not going to go away on its own. Just come see us. Let's get it fixed. Get on with your life, and then you can be happy again. So we're talking about hormone imbalances, and one thing we want to get into now is some natural remedies. We talked about some medical approaches that can be used. We're going to talk about some natural remedies. Now, for women with hot flashes, you can use something called black cohosh, Dong Quai, Donquai, red clover, evening primrose oil. What they do is these can get into the hypothalamus in the brain and act as a regulator. That's your thermostat, and help the thermostat from going crazy, which way you have those hot flashes. Those are real popular ones, and we have a lot of those at our office. If you call the office and ask for Kayla, she's the one in charge of our supplements that aren't on the website. We have a bunch of other supplements we use aside from the ones on the website. Ginseng is good for irritability, anxiousness, sleep disturbances caused by menopause. So ginseng supplements might work there as well. And then ginseng and maca for men with erectile dysfunction. Also, Dr. Joe's nitric oxide support is very good for that because it opens up the blood vessels. We have estrogen regulator. Now, for men, we use the estrogen regulator as well because if you have belly fat, how many men have belly fat? Raise your hands. How many people are too fat, can't raise your hands? So I used to be fat. I can say the F word. So what happens is the hormones, fat produces estrogen, and then estrogen turns around and causes you to lay down fat. So the estrogen regulator is diindolylmethane, and diindolylmethane prevents testosterone from converting into estrogen. And as we get older, we convert a lot more testosterone into estrogen. So for us men, the estrogen regulator works because it helps keep the testosterone levels there. And for women, if they're estrogen dominant, especially premenopausal, when they have too much estrogen, we recommend that as well. So the estrogen regulators for men and women. And then we have the men's hormone support. which is DHEA, and the women's, which is just a lower dose of DHEA. And the DHEA then is the raw materials to help the body produce the hormones. So these are things you can do. Again, follow your medical doctor's advice. Take your medication if you need to. My goal, our goal, is to get you well enough so that you don't need the medication. I'm not here to tell you to take meds or not take meds. We're here to give you tips on how to get well and stay well. And that's where chiropractic comes in. Because if you have a pinched nerve in the low back, what might happen? Back pain, leg pain, hip pain, knee pain, numbness, tingling. How many people have back pain or related problems? Most of you do. But the same nerves in the low back control the colon, the sex organs, and the bladder. So now you might see things like gas, bloating, diarrhea, constipation, urinary problems with men and women, sexual dysfunction. That's the nerve that controls the organs. So you have to have the chemistry right. You got to get the hormones right. You got to get the circulation right. That's why our number 2 selling supplement actually is Dr. Joe's nitric oxide support, because it opens up the blood vessels. And then you got to get the physical function right. You got to make sure you don't have pinched nerves and blood vessels. So that's why chiropractic gets in and works on realigning the vertebrae, taking the pressure off the nerves and the blood vessels, because sometimes you have a pinched nerve, chemicals build up around the nerve root, and that can cause pain. So putting the bones back in place doesn't necessarily unpinch the nerve directly. It reduces the swelling, which reduces the chemicals, and that's why nitric oxide comes in and flushes out a lot of those toxic waste products in there. So it gets a little complicated, but the bottom line, if a bone is pinching a nerve, you got to unpinch it. So if you have health issues, come see us. We have offices in Marietta, Duluth, and Stockbridge. We'd love to be your doctors. We accept most insurances. We try to match your insurance benefits the best we can. We have financing available through Care Credit, car accidents, sports injuries, workers' comp. We'll do everything we can to get you well and keep you well. So if you're suffering needlessly, go to the website, book an appointment, but better yet, call us to book your appointment, because then we can explain all the nuances and the details, what paperwork to fill out. It's a little easier there, too. So the men's and women's hormone supplements are great. Again, I don't recommend the Estrogen Regulator for postmenopausal women. It may not be the best thing for you. But we can do a micronutrient test, and we can test the supplements that you need specifically. And then we can also add on a hormone test for that as well to find out exactly what we need to get you well. So let's give you some more tips on balancing out the hormones, because, gosh, I can't believe it's only 2 more segments of this show. We've got so much to cover. All right, so hormones, it's a fantastical world out there of hormones. It's amazing that they control everything, and we keep finding new things that they do. We're finding that vitamin D is so important for function of just about everything. It has to do with bone growth. It has to do with immune system. We're doing research now, vitamin D in cancer patients. So Dr. Joe's vitamin D is on the website, very inexpensive. I always say it's the least expensive insurance policy you'll ever buy. So I recommend 5,000 international units of vitamin D starting now until late spring, because we just don't get enough sunlight. And the other day, I was out with my friend Tim, and we were standing around outside. We were at an event. And he said this is the first time all summer he'd been out in the sun. And I thought, yeah, I don't get out in the sun like I used to. When you were a kid, you'd go out there, you'd either work in the yard or you'd play football. I play, street hockey. And we were in the sun constantly. And we just don't get out in the sun anymore. So vitamin D is so important to make sure it's right. And we can measure that, by the way, if you want to get it measured with our micronutrient test. But just assume you need it. I take 5 drops a day. I think it's something you really should do. It's on the website there. But hormones come from the word Greek, I guess it's harom is what they're saying, which means to excite or to set in motion. So hormones are essential to every part of your body, and we're just not doing what we need to take care of the hormones. So a couple of things I'm going to recommend we do. Number 1, guess what? Eat a good diet. What a surprise. You want to avoid the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, because they can tip the balance off. You want to stay away from refined carbohydrates and bad fats. You need good fats, but if you're eating bad fats, heated fats, corn oil, soy oil, canola oils, vegetable oils, these are very high in omega-6 fatty acids. And omega-6 fatty acids increase the inflammation in your body. Omega-3 fatty acids, and I take Dr. Joe's omega-3s every day. They're on the website because most of us don't get enough omega-3 fatty acids. And so I take those as one of my supplements, and I take supplements every day. And we have a vegan version because it's the purest form. We don't have to worry about things like mercury or heavy metal toxicity in there. So you got to get those omega-3s into your diet. Processed foods may alter critical hormone levels that are loaded with age-degrading ingredients like sugar, genetically engineered foods, unhealthy vegetable oil, processed sugars, dyes, chemicals, endocrine disruptors. Not good stuff, folks, and you got to take care of that. You want to eat mostly organic food if you can. so you avoid the pesticides and the chemicals. Time for a break again? Come on, I got too much to cover. All right, folks, got a lot to cover. If you have any questions, I only have 2 more segments. The phone number here at the studio, 844-44-Dr. Joe. Today we're talking about hormones. Boy, is this a hot topic. Phones are lighting up. Social media's going crazy. And the thing is that so many people have health issues. They don't know where it's coming from. You've been to every doctor. Raise your hand if you've done this. You've been to every doctor. Nobody can figure out what it is, and they just say, well, we don't know what it is. Well, a lot of times then we have to start looking at the diet, which most people don't look at. We got to look at the nervous system from a chiropractic standpoint. The nervous system controls everything. And that's the thing that I see happen all day, every day. Patients come in and say, I've been to all these different doctors. Nobody can figure out what it is. And we find out it's a pinched nerve going to the thyroid or the spleen or the kidneys or the prostate or whatever it is. And when we administer quality chiropractic care to them and open up the nerve supply, they respond in a very positive manner. And then the thing we do in our office is we also look at the diet. We want to make sure your diet is working properly. We also look at the digestive system, which leads into our next caller. Mark, how can we make your day better?
Hey, Dr. Joe, thank you.
You're welcome.
My son is 14. He's a endurance athlete, and 6 months ago he started experiencing cramping and diarrhea. And while he was running his events, he'd experienced severe cramping that would really affect him, where he was in a lot of pain.
Sure.
He had an upper GI, lower GI. Doctors diagnosed him with reflux.
Yep.
And have prescribed him with an antacid.
Yep.
But I feel we're just treating the symptom and not the problem.
You're singing my song, Mark, treating the symptom and not the cause. Yeah, I see this a lot with athletes because you build up your abdominal muscles and as you're working out, it pushes the stomach up against the diaphragm. So the stomach pushes up through what's called the lower esophageal sphincter, and then the acid comes up into the throat. So antacids and medications help shut down the production of acid or neutralize the acid either way. And there's a problem because you need acid. The acid is there to break proteins down into amino acids so you can absorb the amino acids so you can utilize them. And they become neurotransmitters in the brain. They help with emotions. Stomach and the brain are so closely linked. So what we do in our office is we actually adjust the stomach. We can take the stomach and pull it down away from the diaphragm. And I had this problem for years. I don't know, maybe 10, 15 years ago, I realized what it was. And I remember a light bulb went on in my head, and I grabbed one of my associates at the time, and I said, do this to my stomach. And they did. And for the first time in my life, I had no stomach pain. I always had some or more, but I never had none. And now it's a standard treatment in our office. All my doctors are trained by me to do this because they have to work on my stomach too. So I would strongly advise you bring him in to see us, Mark, and we can test it. If it's there, it's there. If it's not, it's not. And if it's there, we definitely got to get that fixed for him. So.
Sounds good. I appreciate it. Thank you. I will.
Thanks, Mark. Yeah, if you want to make an appointment, folks, the number is 844-44-Dr. Joe. Now you can call to get on the air, but that number rings through to my offices when we're not on the air, and that's during business hours. You can call and make an appointment. You can do it online, too, but I'd rather you call and talk to my staff. This way they can explain everything to you, what to expect. It's a lot easier if you just call and talk to my staff. My staff is awesome. All right, let's take some more callers at 844-44-Dr. Joe. Neil, how can we make your day better?
Thank you for taking my call, Doctor.
Okay, how can we help you?
We order your Supergreens and Essential Source every month.
Good boy. We love that. You Florida guys are cool.
Well, I've been studying physiology since 1980, and everything you say is confirmed by the medical literature.
There you go. You're a smart man. So what do you want to know about water?
Not smart enough. I'm missing the mechanism involved, and of course, I'm not disputing the facts of it. But, for instance, let's say the recommended daily allowance of drinking water would be, say, a half a gallon. Okay,
sure.
A half a gallon of water is 4.6 pounds, so you just added 4.6 pounds. Even if you urinate it all out, you end up with no net loss. So
right.
What am I missing, Doc?
Okay, why water helps you lose weight? The same part of your brain that controls hunger controls thirst. Okay, it's the hypothalamus area. So what happens is many times when you're hungry, you're not hungry, you're thirsty. So many people eat when they feel this feeling, this sensation, and they think it's hunger, and so they eat food, but it actually was thirst. And when you're born, right, dehydration. So there's a part of your brain when you're born that controls hunger and a part of your brain that controls thirst. As you become a toddler, those two parts of the brain grow together. So as a toddler on up, we have a tough time distinguishing between hunger and thirst. So many times when you're hungry, you're not hungry, you're thirsty. And that's why one of the things I suggest in my weight loss protocols is I want you to have a big glass of water, 12, 15, 20 ounces before every meal. And what's going to happen?
Primarily an appetite suppressant?
Exactly. Yeah, that's exactly what it is. And that's how you help lose weight.
One last thing, I'll let you go. You know Clark Howard.
Very well. Mm-hmm.
I thought so. Now, I'm 6 years older than you, but all our lives we've been told that the life expectancy in developed nations in America has been increasing. Clark just reported last week life expectancy is diminishing. It's plummeting.
Yes.
Do you have any remarks? And I'll hang up and thank you.
Okay, thanks, Neil. All right. What happens is this is the first generation ever, this younger generation, the millennials on down, is the first generation ever to have a shorter life expectancy than their parents by 5 years. So now we're decreasing our life expectancy, even with all the amazing technology we have with medicine and MRIs and CAT scans and surgery, which blow my mind. I'm just so fascinated with medicine. But our life expectancy is decreasing. I believe that has a lot to do with we're not getting outside, we're not getting enough vitamin D, where structurally our bodies are hunched over more than it used to be. We're not building up muscle mass. And that's where chiropractic comes in, and it has to be, I feel, the primary entrance port for most healthcare problems. Chiropractic should be first. And we had a neurosurgeon on the other day, Dr. Kajavi, on the show, and he said chiropractic is the least expensive, most effective treatment for back pain, all back pain. Then we add what we do, the nutrition component, because our food supply is just depleted. We just don't have the nutrients in our food supply that we used to. Now, in our office, we also work on the digestive system so you can absorb the nutrients better. And so what we're doing is not only trying to help you get out of pain, we want you to live longer and happier and healthier and less expensive. Because it's so much cheaper to eat a good diet than it is a poor diet. It's amazing. I have a great book. Somebody sent the question on, I think it was Instagram just now. How about a plan for breakfast, lunches, dinners, and snacks? We have it in my first book. It's called Eating Right for the Health of It. And that book has a whole guideline, breakfast, lunches, dinners, snacks, and it also has over 200 recipes. My second book, Prescription for Extreme Health, is an overall guideline on how to live your life. We talk about the nervous system, the digestive system. So if you're a reader, we have the first book as an ebook. We're getting the second book. We're getting Prescription for Extreme Health an ebook, aren't we, Garrett? We're doing that? Say yes? Okay, yes.
Working on it.
Okay, good. But we have the hard copy of a book as well. So if you like books, you can go to the website and order them there as well. And then also just listen to our shows. On the website, we have a great lecture I did called The 7 Deadly Sins of Nutrition, the 7 foods you want to avoid. And then after you type that in the search bar and find it, then I want you to type in, so what can I eat? And then type in, so what can I eat? And that's going to tell you how to eat. Breakfast, lunches, dinner, snacks, and a whole bit. So, and that's on the website. That's no charge either. So that's great. But the minimum supplements you should be taking every single day to give you the minimum amount of nutrients that you need are Dr. Joe's Supergreens and Dr. Joe's Essential Source. They're 2 powders. They taste great. We also have a mint Supergreens. It has a mintier flavor. I personally like the non-mint. It's a little earthier. But I like that one better. Some people like the mint. Whatever makes you happy, we want to make you happy. So that's the minimum you should be taking every day. In the winter, absolutely vitamin D. Anytime you eat a cooked meal, Dr. Joe's digestive enzymes. We talk about hormones. We have the male hormone support, female hormone support, and the estrogen regulator for men and women that have belly fat. Now, women, if you're postmenopausal, don't take the estrogen regulator. I hate to tell you not to take a supplement, but that's one I don't want you taking at this point. But the vitamin D is so important. It's so inexpensive. I take 5,000 international units a day. It's 5 drops. If you want me to do a whole nutrition workup on you, you can actually call the office and get that set up. We can do one specifically. But better yet, just make an appointment. If you have neck pain, back pain, shoulder pain, stop suffering. Just come see us. Get
News and talk.
Hey, folks, Dr. Joe here. Can you believe it's the last segment of the show already? Unbelievable. Now, great show, as they all are. If you missed it, you can go to our website tomorrow, drjoe.com. It's going to be on the website. We have over 1,000 hours of podcast there, audio and video. If you have any questions, any suggestions on the website, send us any suggestions you have for the website. We're trying to, spruce it up and make it as user-friendly as we can. So if you find something on the website you're not happy with, send us a message through the website and let us know that so we can improve it, because we want to get you well and keep you well. All the supplements are on the website, of course. Make an appointment. Stop suffering. I mean, it breaks my heart. I've been in practice for decades now, and patients come in and they go, Dr. Joe, I've had this problem for so long, 2 years, 10 years, 20 years, 30 years. Just come see us. If we can help you, if we think we can help you, we'll tell you. If we don't think we can help you, we're going to tell you that too, and then we're going to say this is who we think can help you. So this is the entry point. This should be your portal of entry when it comes to healthcare. Come see us, and let's see if this is something we think we can help. You can make an appointment online at drjoe.com, but I prefer that you just call us at 844-44-DR-JOE and talk to my staff, because then they can answer questions and make sure you get all the information you need. So just make the appointment. Stop suffering. If you've ever been in a car accident, you need to come see us. You're not tougher than your car. If the car was damaged, you were damaged. Woody, how can we make your day better?
Hey, Dr. Joe. We have a teenage daughter who is type 1 diabetic, pretty severe, and we were told that good chiropractic care could help increase her pancreas output. Is that true?
It could. I can't say yes, but it could. But we've done extensive research on diabetes. In fact, if you go to our website, drjoe.com, type in diabetes. We did a show a couple of months ago on diabetes. We talk about type 1 and type 2. But the nerves in the mid-back do control the pancreas. Absolutely true, and that is correct. Getting her diet straightened out is going to be vital because she's got to be careful. In fact, one of our secretaries, Brendan, he's type 1 diabetic. He says that, so I can say it on the air. And he said, too, he's gotten amazing results through chiropractic care and stabilizing his diet and getting adjusted. So the answer is a very, very positive maybe. Yeah.
Yes.
Yeah. And, we have one office not far from you. We have one in Stockbridge. So we'd love to have your daughter come in and let's see if we can get her healthy.
Great. Thank you very much.
Thanks,
Appreciate
Woody.
it.
Appreciate it. All right, folks, if you have any questions, last chance, 844-44-Dr. Joe. If we don't get you through, you can always send a message through the website. And make sure you follow us on Facebook and Instagram. We live stream a lot of these shows, and so you get to see my pretty face and hear my the Joe-it-alls, as we call them. We got Ahmad and Lewis and who's that other guy over there? Garrett? Is that him? Is he new here? So Garrett's our producer. You can follow us if you want to. And everybody wants us to have Joe-it-all merch. Everybody says, you need merchandise with Joe-it-all on it. So Garrett's probably going to make me do that soon. So look out for that. All right, a couple of things you can do as we wrap up on things you need to do to balance out your hormones. Fat-soluble vitamins are going to be very beneficial to produce sex hormones. Those would be vitamin A, D, E, and K. Now, where do we get vitamin A, D, E, and K? From a good diet. Dr. Joe's Supergreens, Dr. Joe's Essential Source, Dr. Joe's Vitamin D, which is an addition to the Supergreens and Essential Source. You need to take that, especially as the weather starts to turn and it starts getting cooler. You're not out in the sun. Nobody's out in the sun like they should be anymore, I don't think. So vitamin D is vital. And if we do a micronutrient test on you, we can actually test the vitamin D levels too. So things to do. Eat a whole food diet rich in what? Fruits, vegetables, nuts, and seeds. Very, very important to do that. Eat lots of dark green leafy vegetables. They're rich in magnesium, which facilitates the sex hormone production. Magnesium supplementation can also improve sex hormone levels, including your testosterone and your HGH. One of the supplements most people are deficient in is magnesium. Iodine, magnesium, vitamin D3, and omega-3 fatty acids are the four that most people are deathly deficient in. And so where do you get your magnesium from? Eating things like nuts. Nuts are usually high in magnesium, but of course, Supergreens and Essential Source are there for you as well. A couple of things you want to make sure you're getting the omega-3 fatty acids. High-quality proteins from plants. Much easier to digest plant protein than it is to digest animal protein. And so plant protein is fine. But here's the thing with protein. Number one question I get by far, Dr. Joe, if you don't eat meat, where do you get your protein? You don't need any more protein. You need less protein, as a matter of fact. Your body only needs about 8 to 10% of its total caloric intake as protein. Anything beyond 10% is going to be wasted and actually has to process through your liver and your kidneys. And that puts a big strain on your liver and kidneys. And we don't want to put strain on our organs. We want to take the strain off our organs. So if you're eating meat, which is about 17% protein, that's almost double what you need. And all that extra protein has to be processed through your liver and your kidneys. And the kidneys are closely related to your adrenal glands. The adrenal glands are one of your hormone-producing organs. So I try to avoid that. And plus, a lot of commercial meats have steroids, hormones, chemicals, pesticides, herbicides, genetically modified food, glyphosate. So, yeah, I find all people do much better with the less animal protein that they eat, not more. You want to avoid the sugar and the fructose, even things like fruit juice, because they rapidly spike your blood sugar and they effectively block hormone secretion. So there's a problem right there. If you're eating sugar, it can block your hormone secretion. Another reason to stay away from sugars. Alcohol consumption. It decreases your growth hormone production. Having just one alcoholic drink a day can reduce your human growth hormone by 75%. Also, alcohol lowers your testosterone levels. So people think, I'm going to drink and I'm going to get all cute, and cuddly, and romantic. Doesn't work that way, because alcohol lowers your testosterone level. It may make you think that you're sexy and you can dance, but neither of those things happen. Now, Ahmad doesn't need either one of those because he's already sexy. I assume can you dance? I've never seen you dance. Can you dance, Ahmad?
I've been told.
You've been told?
Sure.
Okay. I'll vouch for that. Okay, good. All right. So, so Ahmad doesn't need any alcohol, right? Now, he's good looking.
I'll let you speak for me.
I'll speak for you,
Go
yes,
for it.
yes. That's it. necessary for me. I look good when people are drunk, so you don't have to worry about that, but I do. So, regular alcohol consumption, got to stay away from that, folks. It just messes with your hormone. It just wreaks havoc on it. If you're eating a lot of grains, wheats, things like that, that's just a ton of sugar, so you got to stay away from that. Make sure your adrenal glands are working. I take Dr. Joe's Adrenal Support every day. As you get older, if you're over 30 or 35, if you're stressed out, if you're over 35 or 40, you definitely need adrenal support. If you're stressed out under 30, 35, you probably need adrenal support as well. There's a supplement called Ashwagandha, and that's been shown to help the thyroid work very well. Guess where you find Ashwagandha? In Dr. Joe's Adrenal Support. See, when I put these things together, I was thinking about you guys. I want to make sure that you're taken care of. Women, if there's cramping, there's something called cramp bark. And it's a herb, and it helps with muscle spasms, and you can do it any muscle spasms. But there's also, if you come into our office, I can show you there's a trigger point in the foot for menstrual cramps, and you rub it, and I've never had it not relieve menstrual cramps in women. And when I teach women this, they just go nuts. And also chiropractic adjustments help too, because this uterus is attached to the sacrum by something called the broad ligament. And by adjusting, we open up the nerve supply and take the stress off the uterus. At a time, a lot more to cover. If you have any questions, send them to me through the website, drjoe.com.